Nursing management, maintaining tissue integrity. Some of the most frequently encountered disturbances of the tissue integrity include stomatitis, skin and tissue reactions to radiation therapy, alopecia, and malignant skin lesions. Managing stomatitis. Assess oral cavity daily. Instruct patient to report oral burning, pain, areas of redness, open lesion on the lips, pain associated with swallowing, or decreased tolerance to temperature extreme of food. Encourage and assist in oral hygiene, like brushing with a soft toothbrush. Use non-abrasive toothpaste after meals and bedtime. For mild stomatitis, use normal saline mouth rinses and a soft toothbrush. Remove denture except for meals. For severe stomatitis, obtain tissue samples for culture and sensitivity test. Assess gag reflex and ability to chew and swallow. Use oral rinses as prescribed or position patient on side and irrigate mouth with suction available. Help patient minimize discomfort by using prescribed topical anesthetic, administering prescribed system analgesics, and performing appropriate mouth care. Third, managing radiation associated skin impairments. Provide careful skin care by avoiding the use of soaps, cosmetic, perfumes, powders, lotion and ointments, and deodorants. Use only lukewarm water to bath the area and avoid applying hot water bottles, heating pads, ice, and adhesive tape to that area. Do not shave the area. Instruct the patient to avoid rubbing or scratching the area, exposing the area to sunlight or cold weather. If wet desquamation occurs, do not disrupt any blisters that have formed. Report blisterings and use prescribed ointments. Next, addressing alopecia. Discuss potential hair loss and regrowth with patient and family. Advise that hair loss may occur on body part other than head. Explore potential impact of hair loss on self-image, interpersonal relationship, and sexuality. Prevent or minimize hair loss. Avoid excessive combing or brushing, excessive shampooing, and hair processing. Suggest ways to assist in coping with hair loss like purchasing wig or wear head coverings. Explain that hair growth usually begins again once therapy is completed. Next, managing malignant skin lesions. Carefully assess and cleanse the skin, reducing superficial bacteria, controlling bleeding, reducing odor, protecting skin from pain and further trauma. Assist and guide the patient and family regarding care for these lesions, skin lesions at home. Next, promoting nutrition. Most patients with cancer experience some weight loss during their illness. Anorexia, malabsorption are common example of nutrition problem. For this, teach the patient to avoid unpleasant sights, odors, and sound in the environment during mealtime. Suggest foods that are preferred and well tolerated by the patient. Encourage adequate fluid intake but limit fluid at the mealtime. Suggest smaller and more frequent meals. Promote relaxed, quiet environment during mealtime. Encourage nutrition supplements and high protein foods between meal. Encourage frequent oral hygiene and provide pain relief measures to make meals more pleasant. Provide control of nausea and vomiting and decrease anxiety by encouraging verbalization of fears and concern. Also administer appetite stimulant as prescribed by the physician. Next, relieving pain. Use a multidisciplinary team approach to determine optimal management of pain for optimal quality of life. Assure patients that you know that pain is real and will assist him or her in reducing it. Help patient and family play an active role in managing pain. Provide education and support to correct fears and misconceptions about opioid use. Encourage strategies of pain relief that patient has successfully used in previous pain experience. Next, decreasing fatigue. Help patient and family to understand that fatigue is usually an expected and temporary side effect of the cancer process. Help patient to rearrange daily schedule and organize activities to conserve energy expenditure. Encourage patient to alternate periods of rest and activity. Encourage patient and family to plan to reallocate responsibilities such as child care, cleaning, and preparing meal. Encourage adequate protein and calorie intake. Encourage regular light experience which may decrease fatigue and facilitate coping. Next, improving body image and self-esteem. For this, assess patient's feeling about body image and level of self-esteem. Encourage patient to verbalize concern. Identify potential threat to patient self-esteem. Encourage continued participation in activities and decision making. Assist patient in self-care when fatigue, lethargy, nausea, vomiting. Encourage patient and partner to share concern about altered sexuality and sexual function. Refer patient to collaborating specialist as needed. Assist in grieving. Encourage verbalization of fears, concern, negative feelings, and questions regarding disease, treatment, and future implication. Encourage active participation of patient or family in care and treatment decision. Visit family frequently to establish and maintain relationships and physical closeness. Involve spiritual advisor as desired by the patient and family. Advise professional counseling as indicated. Monitoring and managing potential complications. Managing infection. Assess patient for evidence of infection. Check vital signs every 4 hours. Monitor WBC's count and differential each day. Report fever. Discuss with patient and family about placing patient in private room if absolute WBC count is less than 1000. Instruct all personnel in careful hand hygiene before and after entering room. Avoid rectal or vaginal procedures. Managing septic shock. Assess frequently for infection and inflammation throughout the course of the disease. Prevent septicemia and septic shock or detect and report for prompt treatment. Monitor for signs and symptoms of septic shock like altered mental status, either subnormal or elevated temperature, cool and clammy skin, decreased urine output, hypertension, tachycardia, and other dysrhythmias, electrolyte imbalances, tachypnea. Instruct patient family about the signs of septicemia. Managing bleeding and hemorrhage. Monitor platelet count and assess for bleeding. Instruct patient and family about ways to minimize bleeding, like using soft toothbrush. For mouth care, use electric razor for shaving. Avoid food that are difficult to chew. Initiate measure to minimize bleeding, like drop blood for all laboratory work with one daily venipuncture. Avoid taking temperature rectally or administering suppositories and enemas. Next, promoting home and community-based care. Teaching patients self-care. Provide information needed by the patient and family to address the most immediate care needs likely to be encountered at home. Verbally review and reinforce with written information the side effect of treatments and changes in the patient status. Discuss strategies to deal with side effect of treatment with patient and family. Identify learning needs on the basis of the priority identified by patient and family as well as the complexity of the home care. Refer for home care nursing to provide care and support. Continuing care. Refer patient for home care, assessment of home environment, suggestion for modification to assist patient and family in addressing patient's need. Assess change in the patient physical status and report relevant changes to the physician. Assess adequacy of the pain management and effectiveness of other strategies to prevent or manage side effect. Help coordinate patient care by maintaining close communication with all healthcare providers. Make referral and coordinate available community resources. Conclusion. The term cancer is used genetically for more than 100 different diseases, including malignant tumors of different sites. The disease arises principally as a consequence of exposure of individual to carcinogenic agents. Thank you. This content is taken from Harrison Book of Internal Medicine and Handbook of Brenners and Siddharth.